Hi, and welcome to this Friday's 5-minute consult with your favorite family medicine doc. In these videos, I discuss everything that you need to know about some of the most common health conditions listed from A to Z, and today's topic starts with the letter F. So let's talk about the flu. Just in time for flu season. What is it? The flu, otherwise known as influenza, is a viral infection that lasts anywhere from 5 to 7 days. It's typically more common in the winter months, although technically you can get it any time of the year, as it is also known to be very contagious. What are the symptoms? The symptoms of the flu are also very similar to the common cold, however, there are some slight differences that I will go over. For the flu, you can have fever or chills, headaches, body aches, sore throat, stuffy or runny nose, and cough, as well as fatigue. Sometimes the flu can also affect your intestinal system and cause nausea or vomiting. So what are the main differences between the flu and the common cold? Well, in the common cold, the symptoms tend to be a little bit less severe. You may have cough, fever, or runny nose, but typically higher fevers, headaches, body aches, and extreme fatigue are not as likely associated with the common cold. Another important distinction between symptoms of the flu versus the common cold is that with the common cold, your symptoms tend to come on with a slower onset, whereas for the flu, these symptoms can tend to come on more abruptly and more severe. What causes it? The flu is a virus, and its main form of transmission is via droplets through the air. Droplets are small particles from our respiratory system that come out through our mouth or nose when we sneeze or cough. Sometimes even breathing can release these droplets. If you happen to touch something that is contaminated with the flu virus, or you breathe in the air that is contaminated with the flu droplets, you can contract the flu. Diagnosis. If you are concerned that you have the flu, there is an option to be tested for the flu at your doctor's office. This test is a nasal swab that they will insert into your nose. They then can test it under a solution and determine if you have influenza type A or influenza type B. Your doctor will also ask you about your symptoms to determine whether or not they are more consistent with the flu versus a common cold. And on physical exam, they will listen to your lungs and make sure that you don't have any pneumonia. What is the treatment? It's very important to know that the flu or influenza is a virus. That means antibiotics will not work on this infection. So with that being said, the number one treatment for the flu is something called supportive care. For supportive care, you want to be sure that you're drinking plenty of water. You want to be drinking up to 8 to 12 glasses per day, as viral infections can cause more dehydration and you want to prevent from being dehydrated. Also, if you are experiencing stomach symptoms with your flu, including nausea or vomiting, you may want to go light on your stomach. Taking in things like chicken broth or sports drinks may be good just for that time so you can stay hydrated. Rest is also very important. The more you can sleep or lay low while you have symptoms of the flu, the more your body can regenerate its immune system and help fight off this virus. For other symptoms, you can take over-the-counter medications. For instance, you could take Tylenol or ibuprofen for body aches, headaches, or fevers. And you can take cough medicine for cough, decongestants for stuffy or runny nose, or any other over-the-counter flu medication that will help with your symptoms. When you have the flu, because it is very contagious, doctors would recommend that you stay home for treatment. And that's more if you have mild to moderate symptoms. However, if you feel that your symptoms are more severe, then that can be treated at home. Then you can see your doctor and they can provide you with a medication called Tamiflu. Just to clarify, this medication is not an antibiotic, it is an antiviral medicine. It works best and is most effective if it is taken within the first 48 hours of the time you started having symptoms. Of note, this is not some miracle drug that is going to automatically take away your flu, but it can and is known to decrease the severity of your symptoms, and it can shorten the course of your flu by 1 to 2 days. Complications. If your flu is becoming severe or not going away within the proper time frame of a viral infection, it could be that it has led now into a bacterial infection. And these infections could include a bacterial ear infection or a bacterial pneumonia, which both would require at that point antibiotics. You may have even heard of some people dying from the flu. This is true, but it typically happens more so in people who have a lot of underlying health conditions. These underlying health conditions could include obesity or many chronic diseases such as diabetes, high blood pressure, high cholesterol. Other people who may be at more risk from complications of the flu include people who have heart failure or asthma. People who have a compromised immune system may also be at more risk of complications from the flu. And if for whatever reason the flu leads to severe dehydration that requires hospitalization, you could be at risk for organ failure and then death. So you would want to see your doctor right away if you start to develop severe symptoms that could lead to complications. And these include vomiting that does not stop, severe dehydration that causes an increased heart rate, trouble breathing or shortness of breath, or confusion. Now let's talk about prevention. This is something we may have all heard a lot about lately, as we have all been hearing ways to prevent ourselves from contracting the coronavirus. But as you know, the main ways to prevent the flu, or any virus for that matter, are washing your hands, avoid touching your face, avoid anyone who is sick, especially if they are coughing or sneezing. You don't want to be anywhere around their airspace, breathing in those droplets. And also you want to keep your immune system as healthy as you can during flu season, and ways to do that include eating the proper nutrients such as vitamin C, going outside for some vitamin D, getting proper sleep as that helps boost your immune system, and also avoiding stress or stressful situations as that can decrease your immune system. Another form of prevention would be to take the flu vaccination. It is recommended to take every year, as the virus changes every year, so does the vaccination. Especially if you are elderly or have other underlying health conditions, it may be wise for you to take a flu vaccine, but as long as you are practicing the other preventive techniques, that is also very good. And that wraps up our discussion today on the flu or influenza viral infection. As always, I hope that this video was helpful and informative for you all. If you have any other questions on this topic, let me know in the comments section and I would be happy to answer those for you. If you would like to see more videos like this one, be sure to subscribe, as I am releasing new videos like these every Friday, and I will see you on the next video. Until next time, bye!